The following segment is sponsored by Gateway Foundation, Addiction Medicine, Saving Lives.
Could dental work put you at risk, a greater risk anyway, for an overdose? A study published in the American Journal of Preventive Medicine took a look at 8.5 million Americans who had dental work performed in a 7-year period. Nearly 27% filled a prescription for an opioid painkiller such as hydrocodone or oxycodone.
Danielle Dingnet takes a look at the practice that's spearheading the non-opioid medication approach.
Narcotics, we've been using it for years and it's creating problems. So keep doing the same thing and expect different outcome is insanity.
Unarmed in the fight against the opioid crisis.
But we limit the amount of narcotics to patients. We don't give refills on narcotics.
Dr. Jack Krajekian winces at the thought of pulling out a prescription pad and not having options.
If you minimize the exposure to narcotics to the patient, you're minimizing the chances of them getting into trouble in the future.
The toolbox of alternative opioid medications is limited.
The #1 cause of people having trouble developing issues with addictions is their first exposure. Narcotics produce euphoria, and patients chase that feelings once they have it received. So if you minimize that, then we may succeed. Not 100%, but at least it's a step in the right direction there.
That first exposure many times is oral surgeries, like wisdom teeth or tonsil removal. Dr. K and his team here at Mountain's Oral and Facial Center wanted an option to offer patients, young and old, that wasn't a narcotic.
We've been injecting this local anesthetic post-operatively after the procedure is done. And it basically lasts for 72 hours. And our experience here, most patients who've done this decrease their narcotic needs close to 80%.
It's called Exparel, a long-acting numbing medication.
The way it feels is it feels like you went to the dentist, had a numbing medicine. It will feel similar to that, not as intense. If we inject it on the lower jaw, most of the numbing sensation is in the cheek, a little bit in the lip area, does not affect the tongue. So speech is not altered.
It controls the pain for up to 3 days.
Your swelling, they say the swelling, your peak of it is 3 days after surgery. So it really gets them through that peak of their pain and their swelling.
That's Kara Catlett. As a nurse, she helps educate patients about Exparel.
A lot of parents really are worried about their kids having prescription medications and the narcotics after surgery.
But the alternative pain medication isn't just for kids. It's for anyone looking to shy away from narcotics, including recovering addicts.
We don't want to open that door back up for them, and they don't want to even have that available to them. They would rather just use like the ibuprofen or things like this, so the Exparel gives them that longer numbing that can help them get through that peak of pain and swelling to help them get through their procedure.
Everyone's pain level varies. Prescription medication is still an option, and Dr. K warns.
It does not block pain 100%. What blocks it significantly, 75 to 80%, reaches to a point with non-inflammatory drugs, anti-inflammatories, it works really well. So it makes it manageable and less narcotics, and it works great.
As Dr. K mentioned, patients still have the option to be prescribed narcotics, and at the time they're prescribed along with Exparel, but it's a much smaller amount. Thank you for watching. Make sure you subscribe to our YouTube channel and watch more videos from News Channel 20.